Canada's largest children's hospital, Sick Kids in Toronto, is now reporting 7 probable cases of severe acute hepatitis. Now, in recent months, scientists have been racing to understand more about the mysterious outbreak of this infection worldwide, which, according to the WHO, has now affected nearly 350 children around the world. Joining us now with more is Dr. Martha Fulford, a specialist in pediatric infectious diseases. Dr. Fulford, welcome back to the program.
Thank you very much.
So many questions a lot of people have, especially parents, but let's talk about this, what we know and what we don't know. How unusual is this, first of all?
Well, I mean, we think it's unusual, obviously, or wouldn't have been flagged as an advisory and asking physicians to do case reporting. And so the first thing to do is say, we're seeing a pattern of something that seems out of the norm. We're seeing children with inflammation of the liver. And remembering, hepatitis isn't a diagnosis. It means that there's inflammation of the liver. And now we have to try to figure out what's causing it. It's been reported in quite a few countries. And so that's the key is there a link that we're seeing? It sounds a lot, 350, but that's around the world. And so it's always really important to remember there's a huge denominator. So it's still very rare. But I think what's important is that it's being flagged as something we need to look out for and see if we can figure out exactly what's causing this.
So you mentioned whether there is a possible link between them. Do we have any insight into that yet?
So the main working hypothesis at the moment is that it's a virus called an adenovirus, and that's been seen in the United Kingdom, where they have been trying to test for all different types of viruses or bacteria, and just over 70% of the children there had evidence of having a recent adenovirus infection. Some of the cases from the U.S. have found this as well, but it's still a working hypothesis. Adenoviruses are very common. So is this a new adenovirus? Is it that our children have been really isolated and not exposed? Is there a huge outbreak of adenovirus that is mostly asymptomatic? So we're only seeing the very tip of the iceberg. So I think there's still a lot more questions and answers. And so for me as a physician, it's really important that we have a case definition, that we have a series of sort of standard investigations that we want to do. And we want to make sure that we figure out how many of these are new and unusual and how many are maybe not just our baseline hepatitis.
Yeah.
Because we have to remember that we do see sporadic cases all the time. It's rare, but it's certainly something that would be seen very regularly. Children or adults, for that matter, admitted with inflammation of the liver for a variety of different causes, including some infection.
Now, correct me if I'm wrong, but these don't necessarily classify as the standards that we've heard over the years, hepatitis A, B, C, etc.
No, they're non-A to E. So the normal viral hepatitis that we think of are sort of A, B, C, D, and E. These have been ruled out.
So
when it comes viruses that Sorry, go ahead.
No, I was just going to ask, when it comes to, because you mentioned the adenovirus, forgive me if I'm pronouncing it incorrectly, but then it seems like there are 2 layers, right? So we have to understand more about hepatitis, and now we have this other virus that people are trying to understand if there is a connection. Do we have any sense, at least from a hypothesis point of view, how kids may have acquired that more often?
Well, adenoviruses are very common, actually. It's something that we see every single year on a seasonal basis. There are over 100 different types of adenoviruses, and about 50 are known to infect humans. And so it's something that we would screen for on a routine year if we saw, we're not testing it with COVID swabs, but our normal viral swab. We could check for adenovirus if we can check stool for adenovirus. It's not an uncommon virus. It's just that what we're seeing is maybe a very severe manifestation of a virus that's pretty common. So adenoviruses exist, and so we don't know if this is a normal adenovirus that we would normally see that now is causing more severe disease. Is there some co-infection? Is it a new adenovirus? This is still, for me, honestly, a lot more questions than answers at this point.
Doctor, we have less than a minute, unfortunately, but, a lot of speculation online, especially whether there's a link to COVID, linked to possibly the vaccines. What are your thoughts?
I think the vaccine, no, because it's pretty easy to get a history of whether or not somebody's vaccinated, honestly. And some of these children are too young. At this point, less than 18% of the kids in the UK had tested positive for COVID. So it's easy to sort of say, oh, we've got a lot of COVID, therefore this must be COVID. But I would be really cautious about not jumping to conclusions and causing a lot of panic. And I'm maybe it's better to take that step back and say, you know what, it's a very small number of cases, but enough that it's been flagged, and actually let a proper investigation happen without jumping to conclusions or biasing the reports.
We appreciate this. I know we are going to be following this
Pleasure.
very closely because there are certainly a lot of questions that we all have. Thank you so much for your time and your
Pleasure.
expertise, Dr.
Thank
Martha
you.
Fulford, infectious disease specialist. Thank you again.